This recording is going to cover anatomical planes of the body, body regions, and body cavities. In studying the human body, it is often useful to divide the body or its parts into subdivisions or sections. In order to do this, we must make use of certain imaginary lines or planes, which cut the body into different parts. Anatomical planes are used to describe cuts made through a cadaver in order to view structures exposed by the cut. When this is done, one is able to see body structures inside. A sagittal plane. This is a vertical plane that runs through the body and separates or divides it into a right and left portion. This plane does not make a distinction between equal or unequal parts. If we wanted to be more specific regarding equal and unequal portions, we would have to use one of the following. The mid-sagittal or median plane is also a vertical plane that runs through the body, but this time directly through the midline or center, and it divides it into equal portions. The parasagittal plane, this vertical plane would not pass through the midline, but rather off to one side, thus dividing a structure into unequal portions. So remember, right and left sides is your sagittal plane, equal right and left sides is your mid-sagittal or median plane. Unequal right and left sides is your parasagittal plane. The frontal or coronal plane will divide the body or an organ into an anterior or front and a posterior or back portion. The horizontal, transverse, or cross-sectional plane will run parallel to the ground and divides the body into a superior, an upper or top, or inferior, a lower or bottom portion. Body regions. The human body is subdivided into several main parts or sections. Let's start at the top and work our way down the body. The head. This is further subdivided into the skull and the face. The skull or cranium is that portion that encloses and protects the brain. The face is the anterior aspect of the head, which includes the eyes, mouth, chin, forehead, and cheeks. The neck or cervical region supports the head and attaches it to the trunk of the body. The trunk or torso is that region of the body to which the upper and lower extremities are attached. It is composed of the thorax, this is what we call our chest, the abdomen, which is the area between the diaphragm, which is your breathing muscle, and the pelvis, which is the basin-like structure formed by the two hip bones, the sacrum, and the coccyx. The upper extremity or upper limb attaches the trunk and consists of the following. The arm is the portion of the upper extremity from the shoulder to the elbow. The forearm, also known as the antebrachium or antebrachial, is the portion of the upper limb from the elbow to the wrist. The lower extremity or limb also attaches the trunk and is similarly divided into sections. The thigh is that portion of the lower extremity from the buttocks to the knee. The leg is the portion of the lower limb between the knee and the ankle. The groin is the area on the front surface of the body, marked by a crease on each side, where the trunk attaches. Have you noticed that contrary to our normal everyday use of these terms, that the arm and leg only refer to a part of their respective limb? This is why it's very hard to break this habit when we refer to the anatomical regions. Now we all know the correct terms. The body cavity. The human body contains many cavities. Cavities are spaces within the body that protect, support, and separate the various internal organs. There are two principal cavities, the anterior or ventral and the posterior or dorsal cavities. The anterior cavity or ventral cavity is located on the anterior surface of the torso, which is the trunk of the body. It is divided into an upper thoracic cavity and a lower abdominal pelvic cavity by a dome-shaped muscle known as the diaphragm or phrenic. The diaphragm means a partition or wall. The anterior or ventral cavity is subdivided into three additional cavities. The thoracic cavity. The thoracic cavity is the superior portion of the ventral cavity and is surrounded by ribs to protect the vital organs. It contains three additional cavities: the mediastinum, which is the central portion of the thorax, the pleural cavities, and the pericardial cavities. So the mediastinum, media equal middle, stinum equal a partition. This is a broad median partition. It is space that is located between the lungs and extends from the sternum in front to the vertebral column in the back. and from the neck to the diaphragm. It contains the heart, esophagus, and the trachea. The pleural cavity are fluid-filled spaces, and there are two, one for each lung, situated between the visceral and parietal pleural of the lung. The term pleural refers to the serous membrane that covers the lungs and lines the walls of the chest and the diaphragm. This will be discussed further in Learning Unit 2 on membranes. The pericardial cavity is a small fluid-filled space surrounding the heart. This will also be discussed in Lesson 2. Abdominal pelvic cavity extends from the diaphragm to the groin. It is encircled by the abdominal wall and bones of the muscles of the pelvis, and as the name suggests, it is divided into two portions, even though no wall actually separates them. So let's take a look at them. The abdominal cavity is the superior portion of the abdominal pelvic cavity and contains the following organs: the stomach, small intestines, parts of the large intestines, liver, gallbladder, spleen, pancreas, kidneys, and the adrenal or suprarenal glands. The pelvic cavity is the inferior portion. It is bound more completely by bone than the abdominal cavity, and organs in this cavity include the urinary bladder, the sigmoid colon, and the internal male and female reproductive organs. The posterior cavity is the second principal cavity is the posterior dorsal cavity, and this is located near the dorsal or posterior surface of the body. It has two subdivisions. The cranial cavity, this is formed by the cranial bones and contains the brain. The spinal cavity is formed by the bones of the vertebral column and contains the spinal cord and the medulla oblongata of the brain. This is part of the brainstem. At first it might seem a little confusing with all the subdivisions. Just remember, there are two principal cavities, the anterior or ventral and posterior or dorsal. So let's take a look at the anterior or ventral cavity first. The anterior cavity is divided into thoracic and the abdominal pelvic cavity. The thoracic cavity has three subdivisions: the mediastinum, the pleural cavity, and the pericardial cavity. The abdominal pelvic is divided into the abdominal cavity and the pelvic cavity. The dorsal cavity is divided into the cranial cavity and the spinal cavity. So let's take a look at what each of these contains. The mediastinum is going to contain the heart, the esophagus, and the trachea. The abdominal cavity contains the stomach, small intestines, part of the large intestines, the liver, gallbladder, spleen, pancreas, kidney, the adrenal or suprarenal glands. The pelvic cavity contains the urinary bladder, the sigmoid colon, the internal male and female reproductive organs. The cranial cavity is going to contain the brain, and the spinal or vertebral cavity will contain the medulla oblongata and the spinal cord.